Governor Greg Abbott announced the state's plan for Homeland Security over the next 5 years.
Yeah, and KVUE's Mike Marut explores the COVID-19 pandemic played a big role in prioritizing the public health system. Mike.
Well, Jenny, Jake, the Texas Homeland Security Strategic Plan for 2021 to 2025 covers a lot of topics. But of course, the bottom line is keeping Texans safe from everything from a public health risk to a cybersecurity attack to terrorism. Now, while the governor has actually set the foundation for this plan back in 2015, almost every section of the plan that was just laid out on Friday references COVID-19.
2020. Unprecedented. Probably the word used most often because of the coronavirus pandemic. Texas and the country stumbled its way through testing and now delivering vaccines.
We've learned a lot from this, but it took this to have better understanding of the supplies that we need to have in Texas and in the whole United States. We just didn't predict any of that.
Friday, Governor Greg Abbott released the Texas Homeland Security Strategic Plan for the next 5 years. The COVID-19 pandemic is mentioned more than a dozen times. It builds on the foundation set in motion back in 2015, where the word pandemic wasn't quite the same priority. The most recent pandemic back then was the swine flu in 2009 and Ebola in 2014. COVID-19 is a bigger pandemic than both. And the 2015 plan has some 2020 buzzwords: improving communication, isolation, quarantine, social distancing, and decontamination in the event of a public health risk. The new plan takes lessons learned from COVID-19 a step further, taking a closer look at infrastructure, healthcare resources, and even warehouse inventory training in the event of another pandemic, how to best get resources in and out efficiently. The 2015 to 2020 plan laid the groundwork, but the 2020 pandemic exposed what still needs improvement. Most recently, COVID-19 vaccine distribution and clearing up communication.
Those don't come to the state. I think that's a little bit of a misconception. They're not shipped to Texas and then we redistribute them out. Those go straight from the manufacturer to those facilities that, one, have the capability to receive and accept the vaccine, and then two, the ability to administer it like we've been talking about. So once that center is...
Now, of course, this is just a plan after all, so it's still going to take some action and some working together from state agencies like Department of Public Safety or State Health Services. And the full plan is actually up on our website right now. That's KVUE.com. Jenny, back to you.
Mike Marut reporting for us from downtown. Thank you so much.